Awesome sauce. Oh, I can go live on Facebook now. Let me see.
Yeah.
Let's see. I'm going to sign in. See what happens. No. Said I didn't have permission. Permission to live stream. This one's missing.
Hello, Tracy.
Hello.
Hi, where are you calling from?
Oh, I saw.
Yeah, we'll do a round of intros in a second here, Irene. I'm just getting the tech together, and then we'll get rolling. All right, so let's go ahead and get started. Thank you all for joining. Today we are being hosted by DataSwift for this brainstorming webinar as we prepare for the October 22nd hackathon for the city of Elyria. And the purpose of the hackathon is to crowdsource and get as many great ideas that are out there in the community that will help us to be able to utilize this once in a lifetime opportunity we have with the American Rescue Plan funds, and as we try to rebuild from this 100-year pandemic. Today, the purpose of today's conversation is to talk about one of the 6 topics, and those topics include community violence and crime prevention. How do we, reduce crime and prevent crime from happening in our city? Travel and tourism. How do we encourage people to come to Elyria and encourage, that industry is really disrupted? How do we encourage that to happen again? How do we also create more green space? We saw people really got reconnected with nature and started to value green space more. So how do we do more of that? How do we support families with more after school and out of school care and child care? We're also looking for ideas of how to get people skilled for the jobs that now exist in this new economy that we're embracing. How do we support small businesses that are now needing to do business differently in this new generation as well? And today's conversation is on mental, social, and emotional health as a result of the pandemic. How do we recover from the devastation that we've all gone through, whether it's social isolation or just the anxiety of trying not to get sick, to help us recover stronger. So the purposes today is to really go through somewhat of a human-centered design exercise together. And I'm gonna pull up one visual that kind of is the process that we learned. And one of our key partners in this is Case Western Reserve University. And working with their MBA program, which I'm an alum of, we do this human design centered processes when we're looking for solutions, which includes you put yourself in the person's shoes that you're trying to serve. You help define what are the problems that they're faced with and the barriers they're faced with. You create solutions, which is what we'll be going through these first 3 phases today. And then you start to build prototypes of those solutions, and then you test those solutions. So the hackathon will be actually the time where we're creating this prototype, and then we'll actually be testing these ideas. The best ideas will be tested after the hackathon. So let's start off just with a round of introductions, and then let's do some, as this empathize piece, you can share your own personal story, or if you want to share the story of someone you know who has really struggled, whether it's been emotional health, social health, or mental health. You can talk about before the pandemic or during the pandemic and kind of what their journey has been. So I'll pass it over, and again, introduce yourself, and then if you could share a story about someone you know or yourself who's had some struggle in terms of mental, emotional, and social health. And then maybe if they've had their own solutions, but what kind of journey they've been on. So anybody can start. Linda, you want to kick us off?
Good morning, Frank. Thank you. My name is Linda Steyer. I'm the Senior Program Officer at the Community Foundation of Lorain County. And what we have seen is that the community, we just started something called Neighbor Up in Elyria to connect residents to each other. We started this last year in the city of Lorraine, which is right next door. And we found that people really wanted to find ways to meet new people during a time when it was difficult to socialize. So we're bringing it to Elyria, and I was partnered with one person at a recent get to know you meeting, and she said that there were lots of things in Elyria that she didn't know existed. For example, we talked about the Elyria Arts Council because she's interested in the arts. And so how do we connect residents with resources in Elyria? So that's my interest in reducing social isolation. Thank you, Frank.
Thank you, Linda. Tracy, you want to go next?
Sure. So just as a default, my oldest daughter is having a baby, first grandchild, and I'm making sugar cookies for the shower on Sunday. So if I disappear, I'm taking cookies in or out of the oven. But my name is Captain Tracy Nappins, or just Tracy is fine. But I am the Executive Director or Corps Officer of the Salvation Army here in Elyria. And I'm probably the newest person to this community. I have only been here just over a year now. Oopsie, there goes the stop. Okay. So I'm probably the newest person to Elyria in the room. And I'm actually also, I'm in the Neighbor Up group that Linda was just sharing about. So I'm just doing, I feel like, although I've been here just over a year now, I feel like I don't know anything about our community or many people in our community because I arrived mid full on COVID. So I'm just trying to do as much as I can to get to know people. But we deal with many individuals at the Salvation Army who struggle with mental health. And we have seen over the course of the COVID that some folks who come to us on a regular basis, you can really see the stress in the way that they are acting and reacting to what's available to them. And so just, anything that we can do to support individuals who really struggle with mental health, I think is super important.
Thank you, Tracy. Thank you. Irene, you want to go next? And introduce yourself and where you're from too, Irene. You're still on mute too, Irene.
Right. Can you see me?
Yep.
Okay. So hi, I'm Irene. I live in Cambridge in England. So it's as expected. It's gloomy and grey, which is what you'd expect from England. And I've been trying to get to Elyria for 5 months now. The United States of America won't let me in. I think they are saying that November, finally, they may open up and I might just go over. I have family and friends in New York and Boston. So I lived in LA quite a bit, so I know a little bit about the US. But we're partners with Mayor Frank and also with Case Western on the hackathon. So, and I'm also the CEO of DataSwift, which is the infrastructure platform for personal data accounts that allows you to own your data and create some cool applications. So I think I chatted this last week, so I'm so glad that Mayor Frank is sharing this week, talking about the what's on the ground in Elyria. And just to share with you a real a situation for me, since we're in the empathy category, I am mindful of that we're now going to fall, where your light is getting less and less, and people tend to kind of fall into a bit of depression and start to feel a bit down. And we got that this week from a relative who admitted that they've been spending a week crying, just crying for no reason at all, just crying, and this is the time of the year where it's really hard when things just get colder and summer's gone and it just gets a lot of people. And some of the ideas that came out in the conversation that we had recently was to have an October box an October box, because we kind of know this always happens in October, because that's when, you know, summer's over and stuff like that, or whenever fall is for a lot of people. And there was another member of our family who did a wonderful Christmas present last year, who spent some time writing 365 pieces of notes to put into a box, the feel-good notes. And they could be everything from a fortune cookie joke to a memory of a past of the person knowing the relative. And so when someone's feeling down, just pick up something in the box and read it, and just makes you feel better. And so this was what was shared, and that was I was mindful of that. I'm not affected, but I know quite a few people are affected this time of the year with issues like this.
Oh, that's great. I mean, that's a great story, and it's unfortunate, but I definitely could see how for some people, some of us felt more comfortable this summer, like getting out and about again and networking and being together, but others didn't feel necessarily ready for that. So here they would have kind of watched people miss out, and now everybody's closing back in. It's like, wow, they're now going to be on their second year of just isolation, being alone. And so, yeah, we'll pick that apart and kind of talk through what that journey might look like for them to get that support. But I've dropped your October box idea in the chat, and if you want to drop ideas in the chat, feel free to do that as well. Next, we're going to go to Kevin. Kevin, if you want to introduce yourself, and then if you want to tell us a story about someone you know, or your own personal story about someone you've seen over this past year struggle with mental, emotional, or social health, and kind of share what their journey would look like.
Sure. First of all, thank you, Frank. These are great. Happy to be here and talk about this kind of stuff. I'm the CEO of a company called Placement Loop, which is developing software to help people improve, specifically workers, to improve their well-being. So we use the job placement as a trigger to improve career well-being, and then we use career well-being as a trigger to improve other well-being factors like financial well-being, and probably in this order, and then health well-being, and then on to social, and lastly, community well-being. So, you know, I think I'm just like everybody else. I have my ups and downs. You could say I'm a bit of a workaholic, which has its disadvantages at times. And so, you know, just personally, definitely there are times where I could use a helping hand from a trusted friend, family member, neighbor, mentor. And, you know, there's not enough professionals to help the masses. So anything that is developing technology to help kind of this embedded skill in every community, small or large, for people to help other people, I think is a big plus.
Thank you, Kevin. And the career aspect that you brought to this, I think, is something that definitely, that's another journey we should map out and talk about today, because for so many people, you can just go down the list. So you had your first responders who are on the front line workers who are seeing this every single day, watching devastation. When they came home from work, they had to isolate themselves from the rest of their families, to having your job shut down and not being a frontline worker and told your work wasn't essential and that you needed to shut down, and the toll that played on you, kind of reassessing and really finding your identity in your work, and then having that disrupted from you. And how do you rebuild that from here? So did anyone else want to introduce themselves? I saw Terry was on. Anybody else want to introduce themselves? Because if not, then we're going to jump right into these journeys. And I'm home as well, so if you hear my baby screaming in the background, it's all good. All right, let's jump right into it then. Terry, did you want to share anything?
No, I'm good. I just pop in.
Hi.
And I just had the introduction from Kevin. You have met Uncle Frank before, and I'll just say hi.
That's beautiful.
Hey, Terry.
Beautiful. And that's the other journey that we need to discuss as well, our children, who for a year and a half, my kids were outside of the classroom. We kept them away from really socializing with other kids. And, you know, the impact, how do we make sure this doesn't have long-term negative implications on their health and the way they connect with one another? So let's go through each one of those journeys, and let's start with the career one, since that seems to be like the safe one to talk about. So let's look at what that person's journey would have been, whether they're a frontline worker who was dealing with the stress of every day, seeing the pandemic firsthand, maybe not getting an increase in pay, but still having to do the same work, to that worker that was told their work wasn't essential and needed to stay home and was on unemployment and really was probably feeling that tension of that, to the person who just wanted to rethink their career. What would you all say was the journey for them in terms, what is the current journey for them to get help for that problem? If they were experiencing those things, what does their current journey look like to kind of rebuild and get that sort of identity and health and wellness back? I'm gonna pull that visual back up again.
Well, I'd like to invite them to our neighbor night, which is October 13th. It's a Wednesday evening. It's a virtual gathering of residents from Elyria and Lorraine to just talk about what matters to them and make some connections. And that's what I, encourage people to.
So a part of this exercise today is putting your feet in their shoes. So we're hoping that you've had some discussions with folks in your circle. That's why we asked initially, like, to think about your personal story or people you've connected with. And now is the time to empathize and put yourself in their shoes to say, all right, if I was this frontline worker, or I've spoken to this frontline worker, this is what their journey looked like. Here's where they went to kind of rebuild and get built back up and kind of decompress from the stresses that they were dealing with. You know, what does that journey look like today for someone who's in one of those predicaments that I mapped out?
So I would just say, as a person who never was sent home, not one day, as a matter of fact, I probably worked twice as many hours as normal, with food distributions and all kinds of extras that we did at the Salvation Army. I think that most folks who were those emergency or frontline workers are extremely burned out. Like, I can't wait. When is my shutdown? Like, I want one. Everyone else got one, but not me. And I think a lot of workers who are medical personnel, or even the poor little grocery store clerk, I think they're feeling like that. They're just like, when do I get a break? Because it never ends. And I think particularly for our store clerks and grocery store workers and things like that, with the workforce shortage right now, those people I think are getting so burnt out, and it's just perpetuating the workforce shortage issue, because the people that have remained strong are like, I don't need that. I don't need to be treated this way. I really feel for some of those folks who are doing those kinds of jobs, I just feel like they are just so beat down. I mean, I've been in Walmart and people are mean, and it's not the little checkout girl's fault, that the line is 20 long. And so I really am concerned about those folks that are doing those kinds of jobs, because they're very underappreciated, and it doesn't seem like it's getting any better. So I don't know if anybody's seen that.
So, Tracy, when I think about behavior, thank you, Tracy, for clarifying that for me and Frank. When I think about that, some of the observations I would see, people are fatigued, they're a little more tired, less enthusiastic about what used to be meaningful to them. And I think that there's also increasing levels of anxiety, just as you said, Tracy. Everyone is getting tired and short-tempered and less patient. so and feeling just disconnected. Anyway, that's what I
That's great
see.
observations. Those are great insights. Thank you. Thank you. Others.
Yeah,
And so, go ahead, Irene.
yeah, I'd like to just talk a little bit about that journey that you were talking about, Frank, because so there is a perception that you know, you're in these stressful jobs and everything, and the what you need is a kind of shutdown, which you probably do. You know, you need a shutdown. You need to, you know, just get away from it all. But I've also just to go through the journey of getting from that to shutdown. I think that's really important, because I think there's a sense from a lot of people to say, oh yeah, you're doing that and now you just got to shut down. It doesn't kind of work like that for many of these workers. You need a process. You can't just say, I had accumulated so much adrenaline debt, you know, in terms of that high intense, where I was fueled by adrenaline every day because I'm helping, I was doing things, and now I have to shut down and it somehow cancels that debt. And it doesn't. And then we've seen it a few times that that is this, and Frank said the word decompress, you know, that's exactly it. There's a process to get a person who's been adrenaline fueled and go to a sense of being relaxed at the end of it. And I don't think we think about that process enough. For example, a lot of some people that I've spoken to have said, yeah, my boss says that after I work so hard, I should just take 3 days off. Like, it's still with me, you know. It's still with me. I can't relax. I can't do it. I can't shut down. I can't cancel it. And and when we think about mental health, this is where it happens. Sometimes you can crash. Like the shutdown happens too suddenly. You suddenly feel the tiredness all at once. You know, and I think there is a process of managing from highly fueled, adrenaline pumped environment where you're getting all these stresses coming at you to being completely shut down. And I think everybody copes with that process quite differently. It will be great if we had some idea of how they can be helped that process, because I think it really helps with the recovery.
Yeah, so one of the pieces I wanted to hear from you all, which is gonna kind of talk to the last piece that you mentioned around people cope in different ways. And so what are some of the ways that you all deal with the stressors of work? Or what are some of the healthy ways that you know of someone who deals with a real high stress job? What are some of the activities that they do or things that they participate in to kind of relieve and renew? Because to Irene's point, it's stress is a part of life, so you can't run from it. But how do you renew yourself? How do you get out of this cycle of sacrifice, and get into a place of renewal? So what do you do, or people who have real high stress jobs, what do they do in terms of renewal and refresh?
Frank, I think that maybe we should change the paradigm in how we think about building solutions and, you know, designing a solution for a worst case example or a use case that's, you know, high stress and an extreme example. I think that maybe if we can design around smaller, simpler interactions. So for example, instead of letting it all build up over time like a volcano, someday it explodes. But here's my example. Every day I have stress and every day I have challenges and obstacles. And periodically I go to a restaurant and I always get the same waitress. And this waitress has the skill to make me feel good. Great service. She makes me laugh. Super kind. She was born to be a great waitress. She loves her job. Every time I walk out of there, I feel better.
So now, Kevin, if I was to unpack that, I would say, what is she saying to you? What type of conversations are you having? Because it's not the fact that she's a waitress. It's now from just my initial reaction to this, you're having some sort of connection and interaction that's relieving to you. And so, you know, because one might say, oh, just go out to eat. Oh, that's the solution. We need to just, you know, that's the solution is we need to give people gift cards so they can go out to eat, and then, you know, they'll feel better. but it's not just that, it's also this connection you've got with another human. So you want to talk a little bit about what that is?
Yeah, it's kind of like the opposite of the stressed out cashier. You know, the cashiers, you can tell they're stressed out. They just want to move me through. They're not kind. They're not polite. But this other person is the exact opposite of that. And I you know, there's body language. There's this feeling of empathy, perhaps. She has an embedded skill to communicate. I'm not sure how to put it in words, but you know, whether it's someone at a cashier, and I've met cashiers like this, there's people everywhere embedded in every community that have this skill to help others feel better. And I think
so in a true, this is exciting. Just real quick, I just want to, so if we look at Kevin's journey, high stress day, he goes into a restaurant that has a certain kind of controlled environment, right? So you check-in area, you got a designated table where you're sitting at. Do you go out to eat with someone else, or is it just you?
Someone else, usually, yeah.
So you got someone else with him, accompanying him. So there's an environment in that restaurant. Now you have this waitress that's coming, and she's engaging with you with positive body language, a positive communication. What else? What else would you say the interaction is giving?
Well, so and part of this paradigm shift is not understanding my journey as a career journey or a financial well-being journey or something else.
What
journey.
Exactly is this waitress doing that's renewing to you?
Well, it's one journey, and all she is doing is helping me enjoy my journey.
Helping you enjoy. So what is she doing?
It's hard to put in words.
Kevin,
this is what the journey map is all about. Once we're able to get low enough in this, you can kind of dissect and say, all right, that positive body language. She was curious about my day, so I was able to speak about my day. She had a funny joke for the day. So once you're able to kind of dissect it, then you say, okay, how can we create more experiences for people where they can have a isolated attention in an environment where they're interacting with someone with curiosity, positive body language, etc. So that's kind of where we get to. And then our ideas go to say, all right, well, we could actually create that environment in a park, or we could create that environment at the Salvation Army. We could create that environment somewhere else. So that's a part of why we do these journey maps to kind of dissect where. So I'll let you think on that, and then let's go to someone else's journey in terms of what you do to renew yourself when you're under high stress, or someone you know who's really, really good at renewal. What are they doing to, renew themselves in a high stress job? Tracy, Linda?
Well, Frank, I'm going to follow up on the example that you talked about, say, cashier. I go to this grocery store and I recognize a few of the cashiers because I go there often enough, right? So I'll walk up to them. This is last week. And so I said to her, I said, I don't know your name. And she said, oh, my name is Michelle. So we start chatting. And I asked about her day. So just like Kevin said, I'm curious about her. And she gives me the same feedback. She said, so looking your phone number, you must live in this area. And I said, yes, I do. And then we chatted a little bit about that. And, at other times we'll check in and say, so what are you having for dinner? I see you're cooking fish tonight. So little bits of interest about each other. We smile at each other. Our interaction is perhaps only about 5 minutes or 10 minutes because there are people behind me, right? And we talk about what that person is doing or what I'm doing. But so treating the other person with respect, with interest, being very open, looking straight at her, smiling, and feeling like, hey, I just got to meet you, and I'm really happy to make friends with you. Like I'm thinking Tracy is new to Elyria. Well, it's time Tracy and I got to go to lunch together. So that kind of thing.
Beautiful. That's beautiful. That's beautiful. And I got some ideas around there, but keep going, Tracy.
Well, no, I was just kind of so like what I'm hearing from this conversation is what's missing from helping people to decompress or to move on in this this journey is really interaction with each other. And I'm not at all criticizing the Zoom meeting, but yet again, right? Our interaction is very different behind a screen than it is when you're in a room together. And I think that that's one of the things to me why people or one of the real needs that's out there is safe ways for people to be able to, you know, enjoy each other and have conversation and things like that. And we're just so limited on those opportunities anymore. You know, I was downtown, I did a big thing at the Apple Festival, the Kids Zone or whatever. And it was a lot of fun, but I have to tell you, just walking around the Apple Fest, people just seemed more joyful. People were excited and it was an outdoor thing. So hopefully it was fairly safe, you know, but I think that those things have just been so missing from our existence that, that I think I believe that people are made for relationship, and without that, then there's really something missing. And everything that I heard Linda saying about the grocery store clerk and I'm sorry, and Larry or Kevin, I'm sorry, Kevin saying about the situation with the waitress, it's what it is. It's what's missing. It's relationship, and it's ways to interact with each other positively. And I don't know how to fix that because, like you said, Mayor, so many people do not yet feel safe to be together in the same room. But I think that that's a critical piece. And until we can get back.
I got a question on that. How do we help people overcome the fear of not being safe in person? What are the barriers that you've heard around people that would need to be in place for people to feel comfortable being in person? Because I think you're right. I think there's nothing that can replace in-person interaction. So what are some of the barriers that are in people's minds mentally, and then just reality barriers that are preventing people from wanting to be in person?
I have an experience to share with that one, if you don't mind. It's we were in church last Sunday, and it's been a while, and the Reverend was getting ready for communion, and my husband went like, I'm not taking that. I don't know what is, and he's afraid, and lots of people are, right? And then I said, just wait, and so the vicar was amazing. He finished his sermon. He took he took the gel. He put up his mask, and then he gelled his hands. Then he did the whole thing, and then he went through all the process and rituals and everything. And then as he got every bit in, and before he started to go down, he took the gel and he gelled it again. And then he walked down, and my husband looked and went like, okay. And he took him. And so it's not what he did. It's the fact that we do it in consideration of people watching us. So it's a bit like acting, knowing that people are fearful, acting to assuage and comfort others. By doing things, then the people look at us and then they feel less anxious. Do you know what I mean? It's that mentality, not the action, but that mindset.
That's good. That's good. Other thoughts around that?
Frank, maybe it starts with measuring what skills people have, or what their I guess you could say maybe some innate talents to communicate well. So for example, let's say that there is this waitress type personality with all these skills. That type person is working in a factory just doing widgets, and she's very unhappy, or he's very unhappy doing it. And they're making $40,000 a year, not bad. But if that personality was in a right fit job career, they're probably going to make 60, 70,000, and they're going to be happier. Their journey has improved. And of course, the exact opposite, you might have somebody who's a cashier or waitress who hates that, and they're awful at it.
Mhm.
And they should be they love that rote work, working in a factory, for example, and they'd be very good at that. So I think maybe that if we cross this bridge, that, hey, human capital is starting to get measured more and more and more. And maybe there's a possibility of scaling right fit better than we have in the past.
No, I think that's a good point in terms of making sure the right skills are aligned with the right professions and careers and passions. But I guess the other part of the question is really looking at, Tracy's point about this need for in-person interaction, and that there's mental barriers that people have right now to getting in person. But then one of the things that I said early on this year when we were starting to plan for events for the year, I said we need, one thing they taught us at Case is they said for every one negative interaction, you need 3 positives to counter it. That if you give someone feedback, you could tell somebody, great job. And as soon as you give them that one piece, the focus goes right to that negative piece. And that they need to have 3 positive experiences in order to combat that one negative. So you think about a global pandemic that we just had and all the negative experiences that people have had, from the George Floyd protest and watching the video of him being murdered on camera to the riots at the Capitol and to the pandemic and deaths and the fear, all these negative experiences. One of the things we said at the city was that we needed to double down on events. Like every event we do needs to be like 3 times as better, and we need to just be excessive in terms of how we do events. We need to make them super fun and super engaging to combat that. But again, not everybody felt comfortable attending those events. But one thing I am excited to see is that there is a lot more attendance than what it has been in the past. That people are so anxious and ready to get in person that we're seeing the number in terms of participation skyrocket from everything that we're doing. So one thing I think we should continue to do is more kind of safe social events. And even with the Neighbor Up group, it'd be great if we can if we can, it'd be great to promote, hey, this group of community people is getting together this Saturday. You may not be a part of the every week thing, but come join, just so they can be in a space with other people in a positive environment, getting that positive interaction from folks, as well as, the events that we have going on in the city. Just continuing with those, even as it gets cold outside, how do we, continue to bring people together safely? Any ideas, thoughts, reactions to that?
I have not been down to Pioneer Plaza recently, but the Elyria Arts Council, David Pavlak and Clint said to me they were going, the Elyria Public Library is going to install the panels that Leaders of Today, the kids, who painted that. I don't know if it's up yet, but certainly if Mayor, you've got the best name recognition, if you told people about it to go out and see it. I don't know if it's up on the library yet. I understand the library just opened.
Yeah, I think
Has
they've
anyone seen it?
installed it. Yeah, I think they have installed. I saw some art on the outside of the building. But then the one thing that I'm interested in as we talk about this is, how do we encourage the interaction from people once they're in those spaces together? So a couple of things I thought about when you all were talking. When I thought about the cashier, when you mentioned, hey, I'm interacting with this cashier, and one of the renewing things about this is that she shows interest in me and I show interest in her. And one of the ideas that came to mind is, what if we did like a Elyria challenge where, if you talk with 5 new people and meet 5 new people and take a selfie with 5 new people that you've learned their story for 2 minutes, that you enter the challenge for a prize to win $500 because you've interacted with 5 new people that you didn't know before. How do we create these, I don't know, that's just an idea, but what do y'all think about, how do we incentivize people to interact with strangers and show interest and curiosity with strangers?
Maybe the
think
restaurants will give out vouchers for a free meal or something as a prize and get them into downtown.
Yeah.
I love that idea.
I think I have an idea of something I've thought about a long time. You know, the word maybe is a very safe word. So, and I'm going to talk a little bit about data, but if the data presented or pinged me with an opportunity that had the word maybe surrounding it, like somebody is here in this space at this park that has interest like you, maybe ping them back. Now, it's an anonymous ping. It's coming to me from technology. But if I am in the mood, yeah, I think I will. I'll ping this, and then they get to ping back. And if they're in the mood, so maybe we meet, maybe we interact, maybe we don't.
Beautiful. That's
Yeah.
beautiful.
But when
It's
when
almost
the two
like
maybes match up,
Pokemon Go, but around an interest. You know, you both found yourself in the same place. You're both looking at the piece of art, and somebody might have just walked away, but now they just got a ping that says someone else is in your area that's also interested in this piece. You know, maybe you might want to interact with them.
yes.
That is cool.
And maybe I won't. And it's all good regardless, but I think that enables the interaction
That is beautiful.
and probably does improve the probability of my journey being improved or my journey becoming happier at that moment.
Yeah, I think that's a great idea. That's a great idea.
The other thing that I found to be very useful is to co-create something together. And maybe there was something that you could do. I noticed that a lot of art installations, and some of the best ones I've seen, created a drawing together, you know, or created poetry together, where, and then one of the most creative things I've seen was a whole, I think a group of 20 people trying to write a story on Google Docs. And then about who was going to write the next line of the story first, because then everybody went, and then he continued, but then, wait, I was continuing that one, now I have to continue his. And it just became an interactive game. And at the end, you'd have a story written by everybody. Then you laugh about, you contributed to line 155, I contributed line 1, and then you have the story of something. And it just brings up the playfulness. And it's actually a bit of play, art, and creativity, which you can kind of digitally do, but then you can then continue that. You can do it with kids. You can say, even number lines are only allowed to be kids, you know, and then then you go, whoops, there's an even number line. So someone has to write the continuation of this story. I think, you know, collaborating, co-creating something that just is progressive could be an amazing idea.
Yep,
Yeah,
I love that.
I think you're right. That reminds me, Irene, if the technology can make it easy for us to co-create value propositions, the value will follow, the co-creation of value will follow that. So if we can meaning you and I both get pinged, we are at the park or in the art gallery, we have the same interests, and we do meet, hey, let's invite some other people. We're co-creating a value proposition to create a group of people at the park that have German Shepherds.
No, that's beautiful. That's beautiful. So this whole idea of co-creation to create community. And so there's so much that can be unpacked there. But I want to make sure we spend some ample time as we round out this to talk about our children. As I mentioned before, our children have faced a different type of interaction with this pandemic, and it's had a different impact. So let's kind of think through what their journey has been in terms of, school shutting down, being home, whether that home experience was good or not, depends on what type of home environment they have, the lack of friendships and interactions, now going back to school, wearing masks, keeping distance, missing out on extracurriculars that they may have participated in. What ideas, thoughts do we have around their pain points as children, and what are some potential things we can do to help them rebuild from what they faced?
Well, that's a tough one, Frank, because my focus tends to go to the parenting, and then I start thinking of parents. So I'm kind of.
I know we got to try to put ourselves in that. I got a fifth grader, so I put myself in her shoes. A reserved fifth grader who already was shy when it came to social interactions, and now is in this environment where she's got a mask on all day and trying to, build new friendships. Not sure how safe their family is. So back in my day, we'd say, oh, you go hang out over their house, but not sure about how safe other families are when it comes to health and if they're vaccinated and all these things. So, go ahead, Irene.
Yeah, that's, so one of the things that, so when you mentioned children, I kind of remember my own kids, and I'm a first generation immigrant into England. And I remember someone told me that one of the things that bring a community and family together is the narrative, is the story. And first generation migrants always have the best stories because it tells about the struggles and everything. And children of first generation migrants, because of the story, are generally high achievers because they see the struggle and that story as a personal challenge to transcend. And I wonder sometimes if a crisis gives us an opportunity for our children to be bigger than themselves than they normally would have been because they would not have this. So turn it around and say, yes, it's stressful. Yes, it's tough. But this is a story and a narrative that needs this family and community. And they have a chance to actually make a difference because they can help their parents. They can make a difference. So one of my favorite one is when my friends all looked at me, and being Chinese, they said, you've got 3 girls and they're all overachievers. You must be a tiger mom. And I went like, what are you talking about? I believe parenting is a spectator sport. I'm never a tiger mom. But then it turns out that it was the narrative between the girls who then said to each other, do you know what mom had to do to get us here? You better study hard. And they kind of reinforced that narrative without mom saying a word at it. And I wonder if you translate that into a crisis to say, look at how mom and dad is. Look at how the world is. Look at, oh my goodness, everything is really tough. And this is the time I think our kids can really tell us that they are not, that they are better. They can be. And they're given an opportunity to grow. I know it's sad, they didn't need to be compressed into that kind of crisis, but I think there might be an opportunity here where they can have their stories to tell through this crisis, and they should be heard.
That's beautiful. That's beautiful.
Yeah, if I could build on that. So I think it would be, a story kind of has a beginning and an end, and we can point to it and say overachiever, and here's the outcomes, what, and break that down. I would like to see that the word narrative kind of implies it's the future's unknowable, and we want to improve our pursuit of something every day. And what the outcome will be, we don't know. But if we improve our pursuit every single day, then we're all on the same plane. And I don't get to look at him as an overachiever or her as an overachiever. I get to look at, what are you doing to improve your journey or the narrative today? And now we're all equal.
I think that you're right. You're right. It's about the knitting, right? The knitting of the family together, knitting of the community together. And the narrative kind of does that. Whatever.
Yeah, I think, for sure. I think that really ties into one thing that happened during the pandemic was, as I mentioned before, with the murder of George Floyd, it created this moment where we started asking ourselves about our history here in America and our history of racism in America, and so many untold stories. And now the cell phones were capturing stories that otherwise hadn't been told in the past. And and we did this thing in Elyria where we did we called it Time to Listen. And this was during the protest. We put a microphone in the middle of City Hall parking lot, invited the city out and said, we want to hear people share their experiences with racism in our city. And I would say there was maybe 30 people who got up and spoke. And I would say about half of them were either young people under 18 or they were adults whose first experiences started in school. And one of the pieces that many of them had said is that they never got a connection with their history in school. They never were taught about African-American history in their school. And they just felt like, even then some said the way it was taught made them feel bad about themselves. And so it wasn't connecting to a positive overcoming narrative. It was more of a negative narrative. And one of the outcomes that we saw as an opportunity was how could we tell the whole story of African-American history and the contributions that they had in our city. You know, people often find pride, and I'm proud. I'm the first African-American mayor elected in Lorain County's history. In their 200-year history, I'm the first African-American elected. It's a county of 300,000 people. And people like find pride in that. Like, but one of the things I often say is that I shouldn't have been the first. This should have happened a long time ago. There's been people before me just as talented, just as smart, but due to the narrative that was in people's minds, they either didn't take the risk and go for it, or they weren't supported in going for it. And so, you know, one of the big takeaways is how do we share the narrative that people, especially marginalized people like African Americans, so that they can tap into that story the same way Irene did and Irene's children did and said, hey, this is what we come from. You know, this is what we had to go through. Let's show up and let's meet this moment. Let's carry the next chapter forward. And that's difficult in America right now, where there's a lot of debate around, you know, today is Columbus Day. How ironic that, you know, America has created these narratives around characters, and we've had a hard time grappling with truth. You know, Columbus is an interesting character that I think is a great analogy of the sort of miseducation we get in the name of whatever you want, patriotism, politics, whatever you want to call it. But it doesn't suit us well in the long term because it, again, lifts up one group of folks and just ignores the travesty and devastation that it has on other groups of folks. And that's a tough one, but I wonder how we can do that for our kids and help them to make sure they're getting attached to a positive narrative. So with that being said, we're getting close to time. Tomorrow, we're doing this again. Tomorrow's conversation. Irene, do you know what tomorrow's combo is on? I'm trying to pull it up.
Parks and Recs.
Oh, yes.
Parks and green space development, which ties into social emotional health. My wife and I earlier today, because of the national holiday, we were able to go out to some parks and do some walking, and there's nothing like that in terms of how we're made up as humans and taking those nature baths and getting out and being around life, natural life. And so tomorrow we'll be talking about what opportunities and ideas do we have around green space development within the city of Elyria. But again, we're hoping the ideas that we come up with here and this kind of journey mapping and thinking that we're doing here in Elyria will help inform other communities as well, and how to use this once in a lifetime moment we have with American Rescue Plan. With that being said, I'll open it up for any questions, for closing comments from any of you all.
I just want to add, when you're speaking about children are hungry for the experience of relationship just as much as adults are. We've opened up our programming at the Salvation Army now. I had to turn off registration. We have too many kids who are just dying for opportunities to be able to play and to be safe and to learn and to grow. And I know that's probably another conversation right out of school time. There was, I think you mentioned that, Mayor, another day, but I think that if we really want to help kids develop and really be able to have positive mental health, they've got to be able to have good, positive things to do in our community. And so, yeah, that's it.
Thank you for that, Tracy. And I'm glad to hear there's a waiting list, because then that says there's a need there. And so let's, as we get into that dialogue, let's figure out what ideas we have to be able to meet that need. And thank you for what you're doing in the community. Linda?
I just want to say kudos to you, Frank. I did not know that you had that microphone in the parking lot. I mean, what a great idea to bring people together. And this has been very interesting to me. So thank you.
Thank you for participating, and I can follow up and send you all the link. It was all recorded. We called it a time to listen. It was all recorded, so I can send you all the link to check it out.
Wow. Thank you.
Thanks, Frank.
Thank you.
All right, y'all. Well, enjoy it. I hope to see y'all tomorrow. Grab your lunch and join me again tomorrow at noon. And I
Okay.
thank y'all for the time today.
Thank you.
Thank you.